I was a cancer researcher at Yale University for over 10 years. And in 2001, I accepted a position at University of New Haven. And right after, a year later, I ended up having Lyme disease. This whole experience practically made me think whether should I continue my cancer research or should I start to do a completely different research. I think that my cancer research background has really helped me to ask different questions in this infectious disease project. My first question was, what happens to Lyme bacteria when you treat it with antibiotics or any other agent, whether when they turn to cyst form or biofilm form or any other form. Obviously, when I was investigating it, I was looking at papers, literature, what kind of different bacteria, protozoa, parasite, virus can be found in a ticks. And I was actually surprised that it was some research in Connecticut that wasn't as comprehensive. I thought it should have been. And let's just go out, let's just collect some ticks, and let's just see what other co-infections can be found in ticks. And that led to discoveries like the mycoplasma discovery and the very recent discovery with filarial nematodes, which is actually both co-infections being published as we speak. And don't forget the brain. Brain is an organ which is very juicy. So actually it is a perfect food for Borrelia. I know it sounds very strange, but brain something we should definitely look at. And if you look at Dr. McDonald research or Dr. Judith Mikloshi research, they find spirochete with immunohistochemistry. They find spirochete right in the brain, especially on those plaques, which is very characteristic, for example, for Alzheimer's patients. Everywhere. Again, from this phone conversation, I know that practically almost every joint in the body can be target for Borrelia. And again, if you think about biofilm, which we're going to talk probably later, being a slimy layer, you need some kind of surface. And I think joints being the structure of it, and even just the anatomy, it would be a perfect space for Borrelia to grow on as in biofilm. I mean, from all research, I can talk about Borrelia. Borrelia has at least 6 to 7 different forms to able to hide. Obviously, the spirochete form, which is the one which is practically the most susceptible for any kind of treatment. But you also has the cystic forms, and also you have the biofilm forms. You have the granular forms. And you have at least 5 to 6 different pleomorphic forms which can reside in the cells. Okay, so we talk about spirochete as a spirochete forms, which is the corkscrew shape. You have the biofilm forms, which I think is probably more than just one forms. We already studying different conditions, how the biofilm forms, and we already find that different environment creates different biofilms. So depends on how many forms you can count, maybe some soft forms, A, B, C, D. Of course, the granular forms, which we find extremely resistant to any kind of treatment. And of course, the I almost forgot the cystic form, the famous form, which is the famous hiding place for Borrelia. It's like, think about like a little cocoon when it can enter and sort of hide until you're done with your treatment. And of course, all the pleomorphic forms, which is probably countless. We don't even know how many different forms can be counted as a pleoformic form. So when I say 6 to 7, it is probably 10 to 20 or even 30 different forms. There's a very interesting syphilis research from the 1920s, 30s, and it's a very famous drawings about the different forms of syphilis, streptomina. And let's see, it's about 10, I would say at least 60, 70 different forms on these tables. We know that some strains are more pathogenic. The strain we're studying, the B31, is one of the monsters. So we need to isolate those strains and do some laboratory research to be sure that what we're seeing is true. But knowing spirochete, I think even the benign strain can really cause lots of problems. So I hope you're right, and I hope we can find that only certain strain can cause those chronic diseases, and maybe we can find some certain treatment. But being a little bit pessimistic here, I'm afraid even the other strain can cause some significant problem. Yeah, the stiff-neck is actually very common. Again, I'm not a medical doctor, so I cannot really answer this question why the stiff-neck is so important. But I think something about the brain having the most delicious food for Borrelia. I wonder this part of the body when most of the time Borrelia reside. I know it sounds gross, but certain part of the body is probably just better for nutrition. If you look at the nutritional requirement of Borrelia, it is quite significant. I don't know if you're aware of it, that when we culture Borrelia in the lab, we have to use a very rich media. Actually, Burgdorferi, who discovered Borrelia, one of the person designed this media, and we didn't have too much luck to replace this media. So Borrelia has a very significant nutritional requirement. I didn't expect that one species like Borrelia can make this very complex biofilm formation. And some of the images which you can see in this wall also shows that definitely even one species is able to create the whole city. And can you imagine if it's more species can join to this biofilm? Obviously it will be way much more complex, and probably they can develop way much more different ways to evade your treatment. Inside the biofilm, unfortunately, you can find all kinds of forms. Let's say we just talk about just one kind of biofilm, the Borrelia biofilm. Just for our research, we could see cyst form, granular forms, and probably some pleomorphic forms. So those forms, we know that they have very much developed a resistance to treatment. Now, on these forms, you even put one more layer of protection. And now you try to treat it with antibiotics. First of all, antibiotics might not even able to penetrate. However, we have seen little channels in the biofilm. So maybe those channels big enough to antibiotics penetrate. But don't forget, antibiotics only works if the bacteria is growing, because that's the whole mechanism. In biofilm, the whole idea is to sort of survival mode. So the bacteria most likely is not growing. Or latest research shows that microfiliar nematodes can be found in ticks. This is a worm. You're going to ask how the worm can fit in ticks. Unfortunately, the larval stage, which is micron size, can be found in the gut tissue. We have shown that 84% of the ticks carry mycoplasma, one of the species mycoplasma. And right now, we sent out the paper a couple of times, but I think because it's such a new idea, the reviewer had really hard time to accept it. Right now, we do immunohistochemical studies to show that mycoplasma indeed in the tick guts. And I have one graduate student, Seema, who is actually finishing up this paper. I think that will be a big one, because mycoplasma is something which is very difficult to kill. I don't know how much you're aware that, if you have like mycoplasma pneumoniae, the treatment is 8 to 9 months long. So now you talk about, the treatment lengths, which is of course, a big argument in Lyme disease patients. If those Lyme disease patient has mycoplasma infection, we definitely have to think about a long-term treatment.